Now we're going to talk about a pretty common disease that you'll probably come across in Montreal. This is because it's also hereditary and it's common to people of African, Haitian descent. And if you work in the United States, a lot of people will have it there too. However, you don't need to be of African descent to have this disease. So, sickle cell pain. Patrick, a 12-year-old boy, is admitted to the hospital with severe abdominal pain. He was diagnosed with sickle cell anemia at 1 year of age and has been in fairly good health. He has, however, been hospitalized on 2 previous occasions with complications of the disease. Recently, Patrick has had several viral illnesses, leading his physician to suspect that his spleen is filled with abnormal cells that are impairing his immune function. And the spleen is an organ that essentially filters all the blood, so it's actually very likely to start to get scarred and fibrosed throughout the course of somebody's life. Somebody with this disorder, that is. Now, Patrick is small for his age because he has a chronic medical condition, and he has several bruises on his lower legs. His respirations are rapid, and he appears anxious. Patrick's parents are knowledgeable about sickle cell, as his uncle also has the disease. They know that their son is experiencing an episode of sickle cell crisis, also known as a pain crisis. An intravenous infusion is started, and Patrick is medicated for pain, and pain control therapy is actually one of the key points of management in sickle cell. It's an art. The nurse attempts to perform multiple tests, and she actually batches them together to give him some rest in between. Patrick is receiving oxygen, and he needs this to actually reduce sickling and to bring his oxygen saturation up to normal levels. What immediate and long-term care do you think Patrick may require? Now, this is a very complicated disorder, so I think watching the video, cartoon rather, on sickle cell will help you guys out. I thought it was a fantastic cartoon, and I wished I had found it earlier in my own medical training. So, what do you think Patrick and his parents need to know about this particular crisis? You can actually take some educational points from the cartoon. And how could you help them manage the challenges of this condition? All very broad questions, but hopefully you guys can consolidate this by looking at the objectives. And we'll all try to answer these questions together as a group. To help you with all the different screening questions that you should ask people about sickle cell, or to even help you on an examination, let's say, I always like to have a memory aid or mnemonic of a cartoon with all the different body parts head to toe that could be affected by a disorder, let's say sickle cell, cystic fibrosis, or even hemophilia. I hope you find this useful.